So initially we spoke about open angle glaucoma, and you said the main recommended way of cure can be by way of eye drops. And then the closed angle glaucoma, and that was mainly recommended laser. And then when it comes to kids, it's mainly surgery. So different types of glaucoma can be treated differently, but that is if you detect it at also the right time, especially the open and closed angle glaucoma, that more where adults are more susceptible to. So doctor, the other thing I also wanted to ask you was about the glaucoma week, because today is the glaucoma day. But we are also aware that there are a lot of awareness campaigns that happened in the past week. But why do we talk about glaucoma now suddenly, and why have we not talked about glaucoma up to now, especially? What is the reason behind it?
One of the reasons is that the people are living longer. So people, and now you know the maximum age we are living has gone up. So that earlier it was in 40s, 50s. Now it has gone up to 60s or 70s in ladies. So that is one of the reasons. So the number of people who are becoming blind, who are at risk with glaucoma, are much higher now. It's because people are living longer. So you will be detecting more patients with glaucoma, and you will be seeing more patients becoming blind with glaucoma as well. So that's the importance. And actually to educate the general practitioners, the general public, we had a number of programs in the last week. Actually we started on 7th of March, that is last week. We want to teach the general practitioners, and so we had lecture series for general practitioners, and then yesterday we had awareness program for patients. Patients means people, the normal people, and so we had lectures, and we had a screening program as well. We were screening, we were looking at the patient's eyes, and the people who are having cupping, who are having suspicious eyes, we were checking their eye pressure, and we were subjecting them to the test as well. In actually the main the station was the Eye Hospital Colombo, but even in the outstations, like where all the eye surgeons are, all our members, as part of the College of Ophthalmologists, that our members were running screening programs and awareness programs for the people throughout the island.
So this was done by the College of Eye Surgeons, is it?
Yes, because we initiated the program is because we wanted to create awareness among people. So we wanted to avoid, because it's actually part of the duty of the college, because our main the duty is to our members, but this is also part of our duty to the society.
So as the president of the Eye Surgeons College, so what is your role when it comes to these awareness programs and things like that? Is it a one-off event, that is where you do it once a year, when the glaucoma week is specified, or is it a continuous activity?
Actually now this glaucoma day is now, it will be there every year, 12th of March. So we will be having series of glaucoma awareness programs, I think even in future as well. Even in my colleagues who will be coming after me will be continuing these programs. And other than that, it's not only glaucoma that we are making people aware of other diseases like diabetes, and then the kids like retinopathy of prematurity. Actually we were having series of lectures, as well as we will be distributing leaflets to the people to be aware of these different illnesses.
So how many patients are there who are detected with glaucoma in Sri Lanka? Is the statistics available, or do you know whether there's an increasing trend? Or
the thing is now, unfortunately we don't have statistics how many people have become blind with glaucoma, because our statistics about blindness are very poor. So I think the last statistics were done long ago. So we are updating the statistics at the moment to find out how many people are becoming blind with different illnesses in the eye. So that is one thing. And Yeah, the other question you asked me was
then I wanted to actually ask you about the message that you have to the audience. That is crucially, what are the things that they have to remember?
The message is, the first thing is, now if you have a member in your family, please check your eye whether you are at risk, because you are at risk. So you have to check your eye. And any person over 40 or 60, at least get your eyes checked once in 2 years or so, by a eye surgeon or a technician who is knowledgeable on this subject. And the third message is, now we come across lot of people who are diagnosed glaucoma, but they don't continue any their medication, their treatment. It's because now one thing I have to tell you is, now when they lose vision up to a certain extent, our aim of treatment is to maintain the vision at the same level. So we are not aiming at improving the vision, because I told you, once the nerve is dead and gone, it's gone forever, so it won't regenerate. So that's why we don't expect any vision to improve. So that is one of the main reasons why people will think my treatment haven't done anything to me. It's because I don't see any difference. But the thing is, now in the long run, if you continue your medication, if you continue using the medicine, your eye pressure will be lowered, so that we can prevent you becoming blind. If you don't do, you will gradually become blind in future, but that will be in years time.
So that means what will happen with the treatment is that it will be maintained at the same level. No improvement can happen.
No improvement can happen.
So that is why we said, like, if you are in the third stage or the last stage, the damage is irreversible, and because of that you cannot get back your vision. So it is the message here is that it is extremely crucial that people get the eyes checked, and if the things that the doctor said was, if there's a family member to the diabetes and blood pressure, please do check a doctor, go and get tested, because if it is detected at the right time, the vision can be managed and maintained at the same level, though it can't be reversed to get the perfect eyesight back, but that is so much better than losing it totally. So on this glaucoma day, thank you very much, doctor, for joining us, and also thanks to the College of Eye Surgeons for taking this eye awareness campaign and glaucoma campaign throughout the past week, the glaucoma week, because as you said, it's a social responsibility, especially on the part of the eye surgeon, the surgeons who are supposed to know better and best about this particular disease. So thank you very much for joining us, and thank you for watching us today. Do join us tomorrow at the same time. Take care and have a good day.